Hello guys. So we have come to the end of your Prostho PG preparation, the discussion about all that, all the topics have been done. But I always tell my students that when you're preparing for a NEET or an MCQ based exam, the preparation is never complete by studying the theoretical aspect. Always your preparation should be an MCQ based learning. That is, if you do not know how to solve an MCQ, if you have read your books 3 times, that is absolutely serving no purpose. Right? At the end of the day, be realistic. You have to attempt to solve the questions. So how to prepare is solve maximum questions, get a theoretical idea and solve the maximum amount of questions. And from the MCQs, go into the theory. That is an MCQ based theoretical learning. So we'll just, and there were some portions that could not be, everything cannot be covered in the theory. So whatever that were left will be covered in the form of MCQs. So I'll have included the previously asked questions in your exams, certain NEET questions, certain INICP questions, and some topics which have not been covered in the theory. All right, and some image based that has been routinely asked in your exam. So yes, we'll go forward and how to attempt to solve the questions. All right. The first question is about Armani classification. That Armani classification, bilateral maxillectomy extending anterior to posterior comes under which classification? Right. So whenever you get a question like this, just understand what is your Armani's classification. Armani's classification is a classification of your maxillectomy defects. Is a classification of your maxillectomy defects. That is, let's say a patient has come to you with any tumor of the maxilla, you have done a surgical resection. Right, maxilla, a portion of the maxilla has been cut off, surgically removed, and you are left with a defect in the oral cavity, and you have to replace it by means of an obturator or a maxillofacial prosthesis. Right, so these defects, based upon their extent, they have been classified by Armani. So this is the classification. The class 1 is the defect is present on one side of the midline. Class 2 is again a unilateral dissection, but the anterior has been left behind. Class 3, there is no alveolar process of the teeth that have been removed. It is only the central portion of the maxilla that is removed. Class 4 is your bilateral antero-posterior resection. Class 5 is just the posterior bilateral dissection, and class 6 is just the bilateral anterior resection. Right? So the best answer for this question, what are they asking? They are asking you bilateral maxillectomy extending anterior to the posterior. Right? So this is unilateral. This is again unilateral. This is central. These three are bilateral. 3, 4, 5 and 6. That is your Armani classification. And for extending anterior to posterior is your class 4. Right? So the best answer for this will be your class 4 resection. All right. Next. This is the previous NEET question. That is, they have asked you, a young patient got his front upper teeth extracted recently. The best Pontic design for replacement. Right. So when we studied Pontics, I told you, it is just the types of Pontic, their advantages and indications that are important. They might ask you a picture-based question and ask you to identify. They might give you a region, right? So this question they have given, firstly, a young patient. See, every word, every question will give you a clue for arriving at the answer, right? Simply, they cannot ask you the best Pontic. No. They have given you a young patient and upper front teeth. Whenever they give an upper front teeth, here they've also given you a young patient. Always think about what? Think about aesthetics. Right? I told you aesthetic regions are your maxillary anterior, followed by the mandibular anteriors, followed by the maxillary posteriors. Even they are aesthetic area. And the non-aesthetic area is just your mandibular posterior, as per textbook. That is, if your question comes, you have to give a metal crown. You can give it in mandibular posterior, not maxillary posterior. Maxillary posterior, we have heard about 7/8 crown. Still, you are preserving the mesiobuccal cusp tip for aesthetics, right? So, for aesthetics, or if I have to rephrase the question, they have asked you, among the following, which crown is the most aesthetic? Which crown is the most aesthetic? And I have given you, I made you right, it is the ovate Pontic. Ovate Pontic is the most aesthetic because an ovate Pontic, you have to surgically create a concavity in the ridge and give a crown like this, so that the crown seems to emerge. The crown seems to emerge from the socket, and this is the most aesthetically appearing Pontic and called as the ovate Pontic. Right? The ridge lap Pontic is not preferred. Saddle Pontic. Sanitary Pontic is highly unaesthetic. Modified ridge lap, yes, it is aesthetic. It is also hygienic, it is very good, but not as hygienic as the ovate pontic. Right? Modified ridge lap, we have studied, it has a T-shaped contact with your crest of the ridge, this buccal and lingual, and this lies at the center of the ridge. This end of the T lies at the center of the ridge. So that is how again you read your MCQ, right? Just think about all the 4 options and important points, whatever you know regarding, you just recap it and that comprises the question.